Every one of us has experienced that agonizing, deep, pulsating pain. The kind of dental pain that signals a medical emergency. You visit your dentist and you are faced with the most frightening choice in all of restorative dentistry. Fight to save the tooth with a root canal or surrender and opt for a tooth extraction. But how do you know if saving the tooth is a wise long-term investment or simply delaying the inevitable? In this comprehensive full HD 3D animation, we will show you exactly how deep the infection progresses, and most importantly, we will define the crucial point of no return, the threshold where saving your tooth is no longer anatomically or financially feasible. Understanding this timeline is essential for anyone facing a major dental procedure. To understand the choice, we must first understand the damage. As you saw in our previous video, dental caries or cavities begins by destroying the protective enamel and the underlying dentin. The bacteria then invades the pulp chamber, the vital nerve and blood vessel center of the tooth. This condition, known as pulpitis, is the source of your severe, throbbing pain. If this pulp infection is ignored, the bacteria travels down the narrow root canals and exits into the jawbone at the apex of the root. This forms a pocket of pus called a periapical abscess. A small abscess can be treated, but this is your final warning. The point of no return is defined by two factors: structural integrity and bone damage. If the tooth's crown is destroyed by more than 70 to 80%, or if the abscess has destroyed a significant portion of the surrounding alveolar bone near the root, the tooth simply cannot be restored. This is when the financial and biological calculus shifts entirely toward extraction. If there is a viable chance of survival, your dentist will recommend endodontic therapy, commonly known as a root canal. This is a meticulous, high-tech procedure aimed at preserving your natural tooth structure. The process begins by drilling an access cavity into the crown. From here, the dentist uses highly specialized miniature instruments called files to thoroughly clean out the infected pulp and bacteria from the tiny, intricate root canals. We see here in 3D how these canals are simultaneously irrigated and disinfected to ensure all pathogens are removed. Once clean, the root canals are permanently sealed with an inert rubber material called gutta percha. After the root is sealed, the tooth is considered non-vital. Because the tooth no longer has its internal moisture and blood supply, it becomes brittle. To prevent catastrophic failure, the tooth is often fitted with a supporting post and ultimately sealed with a custom-made dental crown. The primary benefit of a root canal is clear. You save the natural tooth, preserving your alignment, bite, and, crucially, your underlying jawbone. The downsides are the time commitment, often multiple visits, and the significant root canal cost, which can be substantial. What happens when restoration is impossible? The only choice left is a tooth extraction. While extraction offers immediate, complete relief from the severe pain, the long-term consequences are often overlooked. A few months after the tooth is removed, the socket heals over. However, the lack of the tooth root sends a signal to your body. This bone is no longer necessary. We see in this 3D sequence how the jawbone begins to melt away, a process known as ridge resorption or jawbone atrophy.
The implications are severe. Bone loss compromises facial structure and limits future restorative options. Your adjacent teeth will begin to drift and tilt into the empty space, disrupting your bite and creating new problems. Ultimately, extraction is not the final solution. It is the beginning of a new treatment plan. The void must be filled with either a dental bridge, which requires damaging two healthy adjacent teeth, or a dental implant. Quickly choosing extraction to save on initial endodontic cost often leads to far more complex, multi-stage, and ultimately more expensive procedures like bone grafting followed by implant placement. This is not just a medical decision, it is a significant financial one. For those who have already faced tooth extraction and subsequent jawbone atrophy, modern dentistry offers advanced restorative options. Where significant bone loss has occurred, standard dental implant placement may be impossible. Procedures like sinus lifts or complex block bone grafts become necessary to rebuild the ridge before an implant can be successfully secured. These are surgical procedures that add significant time, complexity, and expense to the total full mouth restoration cost. This underscores why preserving your natural bone structure through a timely root canal is often the more conservative, less invasive, and ultimately less costly route. Every patient who has faced this choice has a powerful story. If you've been through a root canal or an extraction, we want to hear from you. Please share your personal story in the comments section below. Tell us what you chose and why. Your experience can provide essential real-world context for others facing this agonizing decision. And if you know someone considering this major dental work, please send them this video. It might save them time, money, and a great deal of pain. Thank you for watching. We'll see you soon with another 3D masterclass.